put the gown on. This is gonna go over your belly. Remember that?
Mm-hmm.
Okay, put that over your belly for the monitors. We're gonna kind of be quickly going at 3 o'clock.
Yeah.
Okay, so you get changed. You get your stuff on. I'm gonna get you on the monitor, but a couple of us are gonna come in here and whip you through. Okay.
Welcome guys to Nelly's White Lions channel. Wife, mom to the cuties, a career girl and entrepreneur. My name is Nelly, aka Nelly White Lion, because I am married to the White Lion himself.
Hi lovely, this is Nelly, aka Nelly White Lion. I still remember my introduction, but anyway, I'm at the pre-op room right now. So we actually came here. The surgery was supposed to be at 3, but we ran late into traffic. We were caught up by traffic, so we got here. They ushered me into here. You can see that this is the second bag. They put the IV on me to, keep me hydrated. So that's the second bag that is running, and they put this compression socks on me and the gripper socks, which I was telling you guys that you don't need to come with the socks. They'll give it to you here, So this is the compression socks to prevent blood clots. So they got me prepped up for the surgery. What they did was they shaved me down here. Usually they tell you the reason why I'm waiting right here is because they tell you before you come for the surgery, do not eat 8 hours. You have to be NPO for 8 hours. So my surgery was supposed to be at 3, and sorry, my voice is gone. I don't know why it's gone. So I was supposed to eat at 7 o'clock, but I was making my daughter's hair, Sophie, and she got grape, and I forgot because after 7 o'clock I'm not supposed to eat. I'm supposed to be taking like water. So Sophie gave me grape, about 6 grape to eat at 11. So when I got here, I just told them, and it's a good thing I told them, because usually if you don't tell them and you go in for the surgery, maybe you have emesis. Emesis is a vomit, like you throw up. So if you vomit, the thing can get into your lungs, and that can cause aspiration. Aspiration is where the fluid get into your lungs, and that cause aspiration. That can lead to complication, maybe death, God forbid. But anyway, so that's why we're waiting. So instead of 3, they pushed the surgery to 6, not really 6:05, but somebody had to go in, so they had to wait for the food or whatever I ate. So right now it's 6 o'clock, so I'll be going there soon. So somebody has so I have to wait for everything to digest. So always adhere to your pre-op orders from the doctor. So after, from here, like you can see, I have the IV from here. Right now they check I change into this gown. I left the sample urine for them. That sample is to check for protein in my urine, and you know what that means, checking for like trace of protein to see if I'll have like elevated blood if my blood pressure will go up. They ask me a lot of questions about my social life, drinking, smoking, and how many C-section I've done. And from here, they listened to the baby's heart rate. They took off the monitor when they felt that the baby was fine. They always tell you not to shave before you come for your surgery, because if you shave down there, you might have opening cuts, and that might leave trace for infection. They always want to do it because they do it in the surgical way, sterilized method, where they clean you with antiseptic and everything. So they were the people that shaved me. So always listen to them. You don't have to shave if you're going for a C-section. So from here now, I'll be going to the theater room where the anesthesiologist will come see me to put the what is it called again? I forgot the name of. I will just write it down when I remember the name. They will put the stuff in your back through your spinal cord to numb you down from here, so the surgery can be performed. I've seen my doctor. He has come to assess me. I've seen the operating room nurse. She has come to assess me too. So from here, when they take me, my husband will not go with me, but after they prep me up, the anesthesiologist come give me the epidural block to block down here, giving me all the allowing me to sign the consent paper and everything. Then my husband can join. And usually when you come into this pre-op room, they give you a paper for your your baby right, baby certificate, which my husband has with him. That's the paper. That's the paper there. So pretty much this is the room where we are. I don't know what happened to this light. My husband turned it off, and the light is not coming. So this is what they do here. So number one, make sure your NPO. NPO means nothing by mouth. You don't have to eat anything 8 hours before your surgery. If you eat and you don't tell them, they go do the surgery. Sometimes you have, not sometimes, the risks for you vomiting, you know, and the food getting into your lungs can cause major complication, and that's the reason why I am waiting. So this is the pre-op that you got to adhere to, you know, before you go. And when I came in, they took blood from me. They want to check my my blood whatever group. I signed the paper. If any complication, they have to resuscitate me. They asked me if I have like an advanced directive. Advanced directive mean if something is to happen to me in the theater, what they can, you know, what they can do. So I signed some papers for them consenting that I consent to the risks of infection, bleeding, and clots. So you can see this thing I'm wearing on my leg. This thing will keep pumping, squeeze my leg, pump. It helps prevent blood clots. And the socks is in case I want to get up so I don't fall. So they wear you these gripper socks. And that is why I said, if you check my what is my hospital bag, you don't need to wear that. But I came with my flip-flop, and this is where our baby, this is my bag and the baby bag there, and this thing is going to follow us to the room where we, this whole stuff is going to follow us. That's where we keep our safe. They give us this drawer. They're going to follow us after the theater. They're going to take this into the room where I'm going to be staying. So when I get there, my husband will do a tour. Hopefully I'm still strong. I'm so hungry right now. I can't even eat anything. I'm hungry and I'm sleepy and my voice is gone. But anyway, this is the pre-op directive you need to adhere to. And you see, they've already worn me this surgical hat. They took off the blood pressure cuff because my blood pressure was within limit. I think it was about 120/70, and that's the highest I have gone so far. But anyway, thank you for watching. Thank you for listening. Do not be scared. If you are going for a repeat C-section, you don't have to be scared. You just have to go with good mindset and pray and hope for God. Like I keep saying, being to deliver as a Hebrew woman means you being alive, your baby being alive. Two of you come out from the surgical room. That is the meaning. That is the present day definition of you're going to deliver as a Hebrew woman. So do not be scared. Be open. This is a scheduled C-section, and this is in my 39 weeks. Do not be scared. Be open to options. Anything that can save your life or save your baby's life. Do not be scared. Okay? Do not be ashamed. Okay? Thank you very much. If you like this information and you've not joined my family, please do not forget to subscribe, hit the notification bell. Stay tuned for more beautiful, informations. Thank you very much. Bye-bye.